Hi, thank you for joining me on the Healthful Roots podcast. Today, I have the pleasure of having a really wonderful conversation with Dr. A. We met at a conference recently, and she dropped so much knowledge in a short conversation that I asked her to come on here for the rest of us. So, Dr. A, can you please give us your background, how you got into psychiatry, and who you primarily work with?
Hi, my name is Dr. Ahmed. I'm a global psychodynamics psychiatrist, and I practice psychiatry across 3 countries. I started in Egypt, and my first love fell in love with psychiatry was when I was walking the down halls of the inpatient unit, and I saw those patients, and I realized those are my people who I want to help. And then life took me in different directions. I practiced in Egypt, in Qatar, and then the US. So I got the pleasure and the knowledge to work across different cultures. I also like to approach mental health holistically through not only medication but psychotherapy as well. So I'm trained in different schools in psychotherapy, and I like to spread mental health education and to all people, but specifically for midlife professional women, which I'm a huge supporter of.
Yeah, I think that's so important, especially one of the things that you mentioned was more of a holistic approach because I think a lot of times we're giving people a pill, but there's so much that encompasses mental health. And yes, that pill can help and can be a tool, but I think it's just that it's just a tool.
100%, 100%. And that's why I always try to, in my sessions or in the way I share information with my people, is like to address them as a whole. We're not a bunch of chemicals. There is a lot of connections in the brain that is made by the environment, the culture, the expectations of the society, and also our genes and temperament at baseline. And to fully help someone, you need to understand all of that and work on all of that actually.
Yes, 100% agree. And one of the things I wanted to touch base on today was, friendships and romantic relationships, but I wanted to touch on what do you see happen to women who don't have friendships or community outside of their partnership?
So it's called like emotional supercharge because when you have like one person or one, let's say the partner, you're gonna emotionally supercharge them to play every single role in your life. And that will strain this relationship, but also won't set you up for success because you don't have other pockets where you can get that emotional fulfillment. So it can not only strain the romantic relationship, but it also strip you from very good support that you will need later on.
Yeah, and that's something that Esther Perel talks about a lot as well, is that we're putting too much weight on just one person to fulfill all your needs, right? And that's like not realistic. But what tends to happen, and I see this in the clinic, is that women are in midlife and many women realize that their friendships have quietly faded over the years. So why does that happen?
It's because the intensity of those years, right? Because those years have like the career building, the child rearing. So you kind of put all your energy and emotions in that. So to rebuild it, you will need intentionality and you'll need the radical vulnerabilities, which means is first of all, you have to be intention. Like as with everything in life, you have to dedicate some energy and some time to build those relationships. And then the radical vulnerability is that finding the courage to be vulnerable with someone and to reach out first. And with age, and I find it that most women get like more shy, more tired, you name it, like doubting themselves, second guessing themselves a lot. So it takes courage and it takes effort and time.
That's true because it is harder to make friendships as you get older. So that is something that I can see being an issue. And then what if someone comes and they're like, I want to make more friends, but I'm scared. Or where do I start? What would you tell your patient?
Take the first step. I mean, you're not going to lose anything by taking the first step. If it works, you gained a new relation. If it doesn't, you gained telling your brain that you can do this. So the challenge, the empowerment that you get, and maybe next time it will work. And remember, people are different. So it's also about finding your tribe, right?
Yeah.
So trying to find people with similar interests or in similar like circles that also help. And what I tell my patients is pursue your hobbies, pursue
Hmm.
who you are, and that's where you're gonna find your circle for sure. And it will come organically.
Yeah, I definitely agree with that. And one of the reasons that I wanted to talk about that is because, like, for me, female friendship has been so important, like the entirety of my life. I have the friends from high school, from college, from medical school,
Yeah.
and I can tell you, yes, I'm married and my husband is super supportive and lovely, but there are things that my friends know about me, or they know how to encourage me, right, in a way that he might not know how to do it, not because he doesn't want to, but it's just like he doesn't understand, right? And
Mm-hmm.
so that's why I was just like, wow, like friendship is so important. And then I think one of the things that I'm going to ask, maybe, but I feel because I see it in my clinic is, and I'm not a psychiatrist, I just do hormones and internal med, but it's that women will come and they're not exactly happy in their marriage. And then it's just like, how do I advise this person? Right? Because I don't know their partners. So is it truly that there's something wrong with the marriage? Or is it, like you said, that they're putting so much weight and so much pressure on that person to do all these things? So then how would you advise someone in that situation? Like what should they do?
First thing will be introspect and reflection. Every single person, especially a woman in midlife, need to like reevaluate, especially in that midlife phase where things are changing. There is change in hormones, there is change in her phase of life. That forces us to reflect and kind of confront things that are not as comfortable to. And I want every woman to utilize that to figure out who she is, what's her identity, because that's the start of everything. Because we evolve through the years, like who she was in her 20s is probably not who she is right now, and that's okay. But we need to rediscover ourselves, and
Yeah.
that's the first step. Knowing who you are will help yourself and will help your relationship, because how can you handle a relationship if you don't know who you are and what you want, what brings you joy, what doesn't bring you joy? So that's the first step always.
Yeah, that's true. And I think because we're talking about midlife here, the other thing that can happen is that, you are an empty nester. Your kids have left
Hmm.
for college, and then all of a sudden you're sitting there and you're like, okay, well, like who am I without my kids that I need to take care of? And what do I do now? And it's like you said, it's like that introspection of like, am I just feeling this way because so many things are changing, or am I feeling this way because something's really wrong?
So when a woman makes her home life or her role as a wife and a mother her whole identity, when those roles change, what happens is an ego loss psychodynamically.
Hmm.
So you kind of like lose this identity, and then you don't know who you are, and it can happen, and it's okay. It's scary, but I always encourage my patients to look at it with a curious eye, to rediscover who you are. And there is joy and there is power in that as well.
Yes. And going on something that you said was about making, your home life your whole identity. Not that there's anything wrong with that, but I do think that the women that I see and that I've spoken to, they long to have some identity outside of the home life, but they're either feeling guilt, or they're really busy, or like for whatever other reason that doesn't happen. So if I'm a person that's saying, "Oh, I want to have an identity outside of this," what would you say, and why is that important, or is it important? Maybe it's not.
So it's definitely important because, like I said in the beginning, you can't really put all your eggs in one nest, right? Because also we are a holistic person. So it's important and to get energy from different sources. It's important for your identity and for your mental health and for your emotional stability, and because it does affect relationship, right? So that's why it's important. Second, how to do it and the guilt of, like, should I do it? It's because you can't pour from an empty cup. So
Mhm.
if you are burnt out, if you don't have a release with your girlfriends, or if you don't have a hobby that can help you relax and de-stress, so you're continuously stressed and burned out, then you're not going to be the best mom that you want to be, or the best wife that you want to be in the relationship. And it will transfer on your partner, because the way that we work, it's nothing goes away, it just changes forms. So that burnout, that anger, or that resentment, it will just transform and be thrown in your face in a different way until you really release it in a healthy way. Any emotions like that.
Well, I did have a question about resentment. This seems like a good place to put it in. So the resentment seems to build very quietly in long-term relationships. And how does that usually start? And how do we, in a relationship, find ways to communicate where maybe we don't allow that to happen?
So, like you said, it builds quietly, and it's because of the mental load, the invisible labor, managing a household, and being like in a relationship. And over time, women might feel like they are unseen or unappreciated. And that's where the resentment builds. And it leads eventually to emotional disconnection, which is going to be a big problem in your relationship. So if you lose like touch with your self need and you do what we call self silencing, in midlife, like the hormonal changes and the psychological and psychosocial changes kind of uncover all of that and act as a catalyst for women to ask, what about me now? And that can be how you're going to handle that question is going to take take the relationship in different direction. So if you're identifying that you have a lot of resentment built, then it is time for open conversation, clear communication with your partner about how you want to move forward from that.
But wouldn't that be a shock, right? We're talking about midlife, that, you've been going as per usual, and then all of a sudden you tell your partner, who probably has no idea, hey, like things need to change around here. Like, how would you, right? That's very shocking, I feel like. And it might be like you're hitting a wall almost.
So, and that's why it's important the role of open communication and clarity. First, the woman herself need to understand what happened. It did not happen overnight. It was building up, and it's like the lid just flipped right now, and that's
Mhm.
why she is making a change. And once she understands that, she can convey that message to her partner as well. It's like it has been building up, but it's time for a change because I'm not comfortable at right now, and I don't want to continue the rest of my life uncomfortable in this relationship or within myself. So it's not necessarily things need to change, rather like we are entering a new journey, and I want it to be a better journey for
Okay.
both of us. So come join me on it, kind of thing.
That makes sense. I can see that. And I do want to plug here that, I know a lot of couples go to relationship counseling or, but when from the beginning, my husband and I did health relationship coaching, and it wasn't to go to this and guy and like hash out the things that were happening, because we were actually in a pretty decent place, but it was realizing, okay, we're early on in our marriage and we're kind of missing the mark in how we're communicating, right? His style of communication was different than mine, and it was not something, because it seems easy, like, oh, just be open. But if your communication styles are different, that can lead
Exactly.
to a lot of conflict, right? So then, just for anybody who's listening, is that it sounds easy. It's not. It's very uncomfortable to have these conversations. But then also, maybe you do need to find someone who can teach you and your husband on how to have these conversations where it's a conversation and not an argument.
Exactly. And I wanted also to point out something very important in midlife, that we evolve. It's a part of like actually a healthy growth, right? We evolve, our identities evolve, and not only women, men too.
Yeah.
So in midlife, both of us are in different situations, so it is warranted a reevaluation. So I don't want it to seem like, oh, it's women and their hormonal change, and no, it's every single person. That's why you would find men in midlife, doing all sorts of things that are out of their character. It's
Yeah.
because they are not recognizing the change in on their phase of life or their identity, and not able to reflect and handle it correctly. And it will affect their marriage. So it's for both of us. It's not only for women. It's for everyone who is evolving through life. So I wanted to point out this so it doesn't seem like, oh, it's just us.
Yeah. No, that's true. And that's a good point. I see more women. So
Yeah, I know, I
yes.
know.
Okay. And then I wanted to kind of discuss like what is emotional intimacy in a relationship, and are there things we can do to improve that?
So in general, like any any marriage gets stronger if there is uh, emotional intimacy and open communication from the start, and not only relying on outside stuff like work or kids.
Hmm.
And for women, it's important to have that emotional connection, to have a good sex life, right? Because if we are touched out, burned out, feeling unseen or unappreciated, forget it. The desire is not going to be there, and no pill is going to bring it back. So it is important to nurture that from the start. And again, it's going to be the open communication. There is nothing wrong with telling your husband or your partner, hey, I feel so, 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 and let's discuss that. I feel such and such and such. Let's discuss that. It serves two purposes. One is like you're conveying what you feel and like putting it out there, but also you're diffusing that charge, so you're not letting it sit and build up. And that in itself is going to help your relationship and build the intimacy, the emotional intimacy.
I love that you brought up sex, not because it's a sex podcast, but one of the reasons that I also think it's important. I see women come to my office and they're like, "Oh, I want testosterone to help my libido." And they put them on testosterone, their testosterone levels get high or like higher, and they're like,
Yeah.
"This isn't working." And then you're like, "Really?" And then you're like, and then they'll say, "Oh, it's because I'm overweight." And then they lose weight and they have testosterone and they're like, "No, I still have no libido." And then this was when I first started, I was like, what's going on in like your home life? And then they tell me, well, my husband gets home from work and then he's on his phone the whole time and we eat a silent dinner. And then when we're sleeping in bed, he nudges me and says, like, hey, are we gonna have sex? And I was like, wait a second. This doesn't sound like it's a you problem. This
Mm-hmm.
that's not sexy. Right.
Mm-hmm.
And so I think that what I want to highlight is that libido and desire, like you said, is about connection,
Mm-hmm.
right? And then I think we put a lot of pressure on ourselves to just have libido like spontaneously, but it is really tied to that connection you feel with your partner.
100%, 100%. And it's not something that just happen. Um, it's not something that you push a button and it's there. It's something that you nurture
Yeah.
over time. And that's why it's important to have an overall good relationship. Because our bodies respond to that and can identify patterns as well, right? So no, it's very important, the emotional connection and intimacy, which even like I feel like having sex does start way before you take off your clothes. It
Hmm.
starts from that feeling that you get in your like stomach or your heart, like the excitement, the build up. And most people have that when they start dating, right? But they lose it along the way, and it's work to maintain it. It shouldn't be too much work, shouldn't be hard, but it definitely is work. And the way that you work it is different depending on the phase of life. Like, of course, if you have like little kids, just gave birth, like you need to be intentional about it, but it's going to be a little bit different than when you were dating, right?
Right.
Now, if you're midlife, empty nester, it again will change like shapes or looks, but it's still the same at the core.
Yeah, and I like what you said. It has to be something that you prioritize and
100%.
be intentional about, because I think a lot of, like the spontaneous versus responsive desire. I think we watch the movies and we think that something's going to be spontaneous, but I have couples that I know that they schedule it. They have a day, or they're like, this is the day that we're, doing it this week. And I mean, I know that doesn't sound sexy, but actually it is, because you're saying I'm going to prioritize my relationship with my partner.
They actually don't contradict like it doesn't, because to make something a priority depending on your schedule, maybe it needs to go on a calendar, but that day, if you have been having a good relationship overall, having this open communication, you're feeling seen and appreciated, both parties, you'll be excited about that day. You'll plan the dinner, like the sexy lingerie, you'll be excited, so
Yeah.
it will be a good thing. But versus a different scenario, if they put it on a calendar because they just don't have time, but the relationship wasn't leading up to that, there is
Mm,
that coldness, there is that feeling unseen or unappreciated, or you're mentally drained most of the time and there's not that open communication, then you're going to dread that day.
yeah.
You're not going to be able to enjoy it. So it's not only how you plug it in your schedule and being intentional, but also you need that good emotional intimacy. So I feel it's like two parts to make it work, not only one.
Yeah, no, I definitely agree with that. Okay, and with the time that we have left, I kind of just wanted to throw a case at you and just kind of see
Okay.
how would we manage it, right? So I'm gonna plug in the average patient or the average female that I see. And so we have a 50-year-old woman who is very high functioning, and she's coming to the clinic because she's exhausted, but she's working out all the time, trying to eat healthy, maintains a very active social calendar, and she works. And then she's feeling anxious and depressed. And she's like, well, I don't know what's wrong with me. This person never takes time to slow down, and they're asking for, I don't know, an antidepressant or a benzodiazepine or something, right? But you can see as a provider that this is probably a reflection of all the things that they've put on their plate and their inability, because I see this a lot, their inability to slow down. Because I feel like a lot of patients, when they try to slow down, they feel very uncomfortable.
Well, actually, this is a very important point you're bringing up, and I just did a video about that. Like, when you grow up in an environment where love is usually conditioned, like, oh, this B plus is okay, but it could have been an A. You are wired to be always a performer and always doing something to earn that love or that appreciation. So in your mind, slowing down is laziness, is not going to make you good enough, that you're not going to be worthy if you're not contributing something, right? And the more successful and the more high functioning, the more that this loop is reinforced, right? Because you take your worth from your job or raising good kids. So it feeds, and it's good. I'm not saying it's a bad loop, but it will backfire at you at some time. So realizing that when I'm unable to slow down, that's an issue. Definitely look underneath it. Is it because if I slow down, I'm gonna feel unworthy? Is it because I'm anxious, like things won't get done? What is the underlying cause of this uncomfortable feeling? Because it can be a lot of things. What I just discussed with you is one of them. There's no amount of medications gonna make that like fixed if she does not address the root cause.
And is that a conversation that you have with them, or how would you like approach that? Because I think that some people are a little bit resistant to that idea of like, oh, this is actually not normal. Maybe I need to do something. So how would you approach that?
So I think when she comes to you asking for a solution, she is realizing there is a problem. It's just the way of her viewing the reason or the solution of this problem is different.
Mm,
So you're gonna go with that, right? Like you came here, you're presenting this, so you are realizing there is a problem, but what I'm offering you is an alternative reason for it with an alternative solution. And because of the environment we're in and the culture, it is also ingrained in our head that a pill will fix everything quickly, right? It's the quick gratification, which, of course, when we are struggling, that's what the brain wants. So it's going to be gentle, but offering a different alternative perception or perspective is what's going to help her see it. And everybody's different. Someone might go, oh, yeah, you're right. I never thought about that. Someone, it will be so painful for them to like admit that right then and there. So they were like, no, 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 it cannot be that. But let it sit. Give them time. We all need time to process things. And never give up on your patients, especially if they're seeking the help. Just gently reminding them and redirect them, hey, there's an alternate perspective here that I want you to at least consider.
okay. And then this is me being nosy. One of our last questions before we wrap this up is I wanted to know what is the difference since you've practiced in multiple countries now? Is that reliance on medication just, something that we see here in the Western society more so?
So I would say yes, to a big degree. So back home, it's more of because we have that societal mentality that, oh, like, and there's a lot bigger stigma about mental health. So they don't necessarily rely on a pill or think that a pill is going to solve it. I'm not saying that's a better thing because back home they might think, oh, let's go to a priest or a sheikh or something, or just don't talk about it at all, or just
Right.
go talk with your mom. So it's just a different perception. But here, what I noticed is the quick gratification is higher, whether it is versus for a pill or in like a video or something. Versus back home, there is and somewhat in the Gulf area, there is like either there's not a problem or the problem solution is going to take time and you talk about it first, whether with families or with professionals. Luckily, along the years, things have evolved both here and back home. So here now, I find a lot of my patients are actually open to a more holistic approach and understanding that a pill is not going to solve everything, which I'm very proud of my patients for realizing that. And back home, they're realizing that a medication can actually help, and
There's
we
a
still need, yeah, we still need a professional support. You can't just go to mom and she's going to solve everything. You know what I mean?
Yes, no, I agree. And I think what you do and your approach to psychiatry is so unique and it's so needed, at least from the psychiatrists that I know. So I really love what you're doing because I think that we need more psychiatrists like that.
Yeah, thank you so much. And I feel like this is what helps patients the most. And feeling heard and validated and guided is definitely going to even improve with the medication because imagine if somebody's just giving you a pill for some symptoms. You don't know what the pill is doing, what's the expectation or anything. You're left to your own devices.
Right.
With psychiatry is definitely harder because your own devices might not be the best working right now. So I feel it's part of my job is to help them understand what is the expectation from the medication, what are the side effects, what it will help with and what not. That's the basics. And then if something that medication won't help, I have to tell them that, like, out of integrity, like, this is not going to be solved. And if you want to solve it, here is your options.
Mm.
And yeah, I mean, like, I don't know, like, this is the way that I think things should be, actually.
I love that. Okay, I'm gonna have to ponder what you just said because I can use that in my practice. But for the people who want to find you, your social media will be linked. But
Yes.
how else can people get? Is there any other way people can get in touch with you or listen to more of what you have to say?
So as for right now, it's going to be my social media outlets. I'm posting a lot of educational material there. For seeing patients, there will be a link. If someone is interested, can send me a DM, and we'll send them the referral link for where they can book a session with me. I am in Houston, Texas. I am licensed in Illinois and Michigan as well. I do remote and in person. So yeah, that's for now.
Great. Well, thank you so much for being on the podcast. I appreciate your wisdom and your time today.
Thank you so much for having me. That was a pleasure.